Okay, well, I'm back. This is Tom Ferry, CEO of Connected Nation. It's a pleasure to welcome all of you here. We are very excited as this will commence the first in a five-part series webinar on the examining the transformational impact that telehealth is having in America. And of course, the topic could not be more timely and relevant as it is today in a COVID-19 context. So we're very excited to share with you some of the results of a study that we released earlier this year, and we are delighted to be joined by an impressive group of professionals and colleagues here today to help us entertain this discussion. And before we get started, I do want to again say thank you so much. We have been very impressed and humbled by the level of interest and the number of attendees that have signed up for this. So we are anticipating a very good discussion this afternoon, and hopefully the start of a conversation that again will carry forward on a monthly basis from now through October. So we are always excited to bring together stakeholders. One of the great things we do at Connected Nation is to provide a forum for these important discussions and efforts to improve the lives and communities of those that we serve. I will start first with just a general bit of housekeeping here. Due to the large number of attendees, we have elected to, will record the session, and we will certainly be providing a source to that audio post-call, as well as the content that we will share through the course of our discussion this afternoon. So that will be provided to all registered attendees at the end of the call. And to keep us on task and certainly as interruption-free as possible, we have had to mute all of our callers, but we will ask you to please submit questions or comments in the chat area here of the GoToMeeting. Hopefully you're familiar with enough of these webinars and conference calls at this point to be familiar with that chat feature, and so we would encourage your lively use of that feature to keep the conversation flowing. We will make every attempt to entertain those questions as they come in today. In the event that time finds us short and we are not able to answer all your questions, we will make every attempt to respond to those in any post-call correspondence that we should share. And I think with that, we are ready to get started. So again, first, let me introduce myself. My name is Tom Ferry. I'm the Chief Executive Officer of Connected Nation. I've had the distinct pleasure of serving in this role for nearly 12 years at this point, and with every day I'm humbled and amazed by the opportunity to work with the professionals and at the industry level, at the community level, and certainly state and federal levels as well. And so I think what I'd like to do for just a moment here, Brian, if we could advance the slide, is to share with you our agenda for today and hopefully course of our next hour together. To tell you things that we'll take up in the context of this very important topic of telehealth. We will be joined today by our partner with AARP, Melissa Seifert. She will provide some opening comments here momentarily, and then we'll move into a brief overview to help set the table for our discussion today, some of the key findings and results from our recently released telehealth report there in rural Michigan. We will anchor that discussion through Chris McGovern. He is our Director of Research here at Connected Nation, and he will be supported with Mr. Tom Stevenson, who is our Community Technology Advisor there in Michigan, as well as supporting community development in other states inside the Connected Nation portfolio. And he will take us through a moderated panel discussion. We are delighted to have two great healthcare professionals from Spectrum Health today, Ms. Mandy Reed and Dr. Rima Shah. Will support our discussion as we get into that portion of the program. And then finally, of course, we will entertain questions and answers to the greatest extent that time permits. But again, I would encourage you to submit those questions as you have them during the chat feature here. And as we get to them, we can intersperse the conversation with some of those questions that you may submit. Before we start, though, I would like to just spend a few minutes to tell you a little bit about Connected Nation and why we're here. The first thing I would tell you, just a little bit of insight into our mission. Ryan, if you could advance our slide. Connected Nation, we're about two decades into this now, as far as being a force to help improve lives and communities through the expansion of high-speed internet access. We think of our mission in three areas here: access, adoption, and use. And of course, that follows something of a linear path there, because we know that access still is a challenge to many communities in America. This is predominantly at this point a rural challenge in America, with the most recent FCC report indicating something of a quarter of rural communities still lack the fundamental access to enjoy things like telehealth, and certainly the other aspects of our lives that has all moved online now in the advent of the COVID-19 pandemic. But for purposes of today, you'll learn a little bit about the adoption and the use focus of our mission. And we know that this works in total. We know that access, adoption, and use are the three pillars by which vibrant and life-changing opportunities come about because of the proliferation of high-speed internet. For purposes of our telehealth discussion, as you'll soon find out, we intentionally set out with our partner AARP in 2019 with the generous support of the Michigan Health Endowment Foundation, or fund rather, to undertake a study of what barriers exist in the use and adoption of telehealth in rural communities inside Michigan. As I'd mentioned, our mission focusing on the access, adoption, and use piece, we intentionally sought the study of 5 rural communities inside the state of Michigan that largely had begun to meet the access challenges and begun to address those. We wanted to focus our study more, not necessarily where a physical network became a barrier, but more or less to understand in greater detail the challenges that confront the adoption and widespread use of the technology of telehealth. Our next slide, please, Ryan. So in the course of this, we wanted to, again, focus on the barriers and use of telemedicine among the aging population inside these 5 rural communities. The data collected was going to be instrumental in helping us determine 3 things. 1, determining the link between increased telemedicine usage and our overall community health outcomes. 2, we wanted to identify the barriers and issues that might surround the use of telemedicine amongst both patients and healthcare providers. That was a very important the perspective that we wanted to make sure that we understood the supply and the demand, if you will, is best demonstrated by the consumer and the provider of those services. And 3, we also wanted to understand and identify what are the state level policy, what is the state level policy landscape, and then juxtapose that to what the national regulatory and policy landscape is, and which ones begin to promote and support the widespread use of telemedicine. Now, fortuitous for us, this study wrapped in 2019. We went into final analysis into early 2020 and released this report just on the eve of the national crisis and pandemic that we know now as COVID-19. So again, the conversation is extremely relevant to the things that we are seeing right now. As we know, COVID-19 and telehealth has had a transformative effect on our nation's healthcare delivery system. We've seen, obviously, moves by CMS, as well as many industry players that have recognized the importance of telehealth as a means to deliver patient care in a safe manner while also protecting our frontline healthcare workers. We again continue to see the pressures and the incentives to increasingly adopt connected healthcare platforms to improve the access to this care. And so it is obviously in our collective best interest to make sure that even as we emerge, hopefully one day, from the COVID crisis, that the use of telehealth is here to stay and to continue to add to the improvement of individual and community life in areas across America. So that brings us to our objective and mission for today. One of the things that we would like to do now, as we've published our study and have begun to speak on it publicly and elicit feedback, is to move into our next phase, and that is to create the awareness of the discoveries that we have and insights that we have collected as a means of this study, for purposes of helping understand basically what the patient and the provider barriers are. We also want to make sure that where there is a live and vibrant use of telehealth, we want to make sure that we are capturing and sharing the best practices, so that we continue to reinforce the good associated with this new technology and application. We also want to understand what those barriers are, so that we can begin to help inform the state lawmakers and executive branch there inside Michigan to help create the right policy and regulatory framework to not only incentivize but to sustain the use of this much needed application. And last but not least, as I mentioned earlier, there is a keen sense amongst all of our stakeholders at this point to use the COVID-19 backdrop or learning lab, if you will, to understand in greater detail the things that are now front and center for all of our new normal as it pertains to access to America's healthcare system. So I assume certainly as we get into our discussion today, many of you will be referencing experiences that you have, certainly pre-COVID, but certainly post national pandemic here, or I should say in the midst of our national pandemic, real life experiences, who many of you may not have had a telehealth experience to speak of prior to March, but certainly I suspect that most of us on this call now have either participated directly or indirectly in the care of loved ones that have now employed a telehealth solution. So we're very excited today. I do want to, without further ado, introduce our esteemed colleague from our partner organization, AARP in Michigan. And with that, I would like to introduce Ms. Melissa Seifert. Melissa is the Government Affairs Lead for AARP Michigan. In this role, she has executed AARP's legislative priorities to both state and federal elected officials. AARP, as you know, is a nonpartisan 501c4 organization that represents nearly 1.4 million members inside the Michigan borders. AARP advocates on the issues that matter most to the people of age 50 and over and their families, such as health, long-term care services, income security, support for family caregivers, retirement planning, and protection from fraud and financial abuse. Now, Melissa in this role is no stranger to Lansing and the capital city. For 16 years as a legislative staffer and multi-client lobbyist, Melissa has worked now for AARP for 8 years, first as the Associate State Director for Economic Security and Workforce, and now focuses her attention on financial security, workforce development, social security. Melissa holds a master's degree in administrative science from Central Michigan University. And Melissa, it's a pleasure to be with you.
Just, real brief, I just wanted to thank Connected Nation and Connect Michigan for giving AARP this opportunity to speak on today's call. I think many of you might be surprised to hear an actual employee of AARP, but I have 11 colleagues that work with me throughout the state of Michigan, and we're really just trying to better the lives of those 50 and older. So I handle our government affairs, which is basically a fancy title for lobbyists, but rest assured I am one of the good ones. But I work at the Capitol and advocate for the 1.4 million AARP members here in Michigan on policy issues that matter most to you and your family. We have been advocating for a variety of issues like financial security, fraud prevention, increase in state funding for services, and obviously why we're here today, increased access to healthcare through telemedicine. It seems like a short time ago that I had a meeting with Eric Frederick, who is the Connect Michigan CEO, with what seemed like a crazy idea, and that was to go into 5 Michigan communities and take a years to accessing telemedicine. And now here we are talking about the results, which you'll hear later on today. So, just briefly, AARP has always strived to find policy changes that positively affect access to healthcare, and telemedicine is one of those ways. This promising technology can help people live healthier lives and make it easier for family caregivers to care for their loved ones, which, you just stated earlier in your comments. A good example is, transportation to medical appointments can be a major obstacle for older adults. And so utilizing telehealth technologies can allow older adults and their family caregivers to consult with a doctor to better manage their health without taking a trip to the doctor's office. And especially during this pandemic, we're seeing even more people utilizing telehealth to lower their risk of exposure of COVID-19. So before the term COVID-19 and the coronavirus was a common phrase, AARP has been working with a group of legislators to pass legislation that would expand the definition of telemedicine to allow reimbursement for Medicaid recipients, and define your home and school as an originating site, which just means that you can utilize telemedicine from your home or a school and get reimbursed through your insurance. And also, this new package of legislation would allow a new form of telemedicine to be reimbursed. And that's called file and send. And what that means is if you have a wound or an eye infection, you can take a picture and send it to your doctor to take a look at it. And they can either prescribe you a medication or they can send you to a specialist, all from the comfort of your home. This package, I'm excited to say, has made its way all the way to the governor's desk, and we are hopefully and positively excited to have her sign this into law. And that should happen any day now. So the expansion of the definition of telemedicine is just going to make all of our lives significantly easier. I know a lot of you on the call today are worried about privacy issues when you're using telemedicine, or are confused about how to utilize this new promising technology. And that is why it is so important that you stay on this webinar so you can be assured your privacy is safe, the care you're going to receive is just as good as going into your doctor's office, and it's easy to use. We are partnering with Connected Nation because AARP believes in this tried and true technology, and we want to reach out and educate you on the benefits of telehealth. So I'll leave you with this. There is still more we can do to enhance healthcare through telemedicine. And AARP, again, is thrilled to use the findings in this report to fight for those policy changes at the Capitol. AARP has been educating on a whole slew of issues during this interesting time that we're in. And so I encourage all of you to visit our Facebook page, which is just AARP Michigan. There you'll find updated information and tips and tools you can use to help you through this interesting time. And then also our website, which is www.aarp.org/mi. And once again, thank you for this opportunity to talk to you today. And thank you all for taking the time to join this important webinar. And again, thank you to Connected Nation and Connect Michigan for allowing us to participate.
Melissa, thank you so much, and wonderful to have your partnership and certainly your spirit and enthusiasm in helping us forge into this new area, not only for Michiganders, but also as it begins to help inform national policies and strategies. Certainly, as we can point to Michigan to serve as that exemplar and model for other states and communities, we certainly look forward to port these findings into other areas across the country, particularly during this very important time in our healthcare landscape. So thank you. I want to introduce now someone who will become a fixture for the balance of this call, and that's Mr. Tom Stevenson. Tom serves as our community technology advisor here, not only in Michigan, certainly as a proud Michigander himself, but also his expertise and knowledge over the last decade in this area has been a great source of influence in communities all across the country. Tom's work expands beyond just Michigan into communities in Ohio and Texas and other areas where Connected Nation is actively engaged in community technology planning. Tom, let me turn the microphone over to you, welcome you, and certainly leave the balance of our call in your steady hand.
Thank you, Tom. Again, I'm Tom Stevenson. I'll be today's moderator for this call. First of all, I'd like to introduce Chris McGovern. Chris is the Connected Nations Director of Research Development and is the key researcher and co-author of today's Connected Nation Telehealth Report. So today, Chris will provide an overview of the telehealth study and its high-level findings. Chris, it's all yours.
Hey, thank you, Tom. Yeah, my name's Chris McGovern, and I work with Connected Nation and Connect Michigan on a variety of research areas. And one of the things that I had the honor of working on is the telehealth report that we put together and released earlier this year. So the study involved really a three-pronged approach where locally we looked at 5 different rural communities across Michigan, and those counties were selected because of their the wide variety of populations and economic situations and employment and healthcare networks, ranging from the mining communities in Dickinson County all the way to the farming towns of Sanilac County and everywhere in between. We wanted to get a good representative sample across rural communities in the state. So in those 5 communities, we spoke with heads of households, adults who had either used telehealth applications or those who hadn't. And we wanted to find out both sides of that story to see what their impressions were with telehealth, with their telehealth use, or if they hadn't, what kind of barriers had prevented them from using it. We also spoke with healthcare providers in each of those communities about the services that they provided through telehealth, and once again, what kind of things they were looking to do to expand, or in some cases, what issues had prevented them from being able to expand their telehealth services. And then we wanted to get a national view, so we took a high-level look at states, their telehealth policies, as well as the the broadband connectivity in communities across the country, because telehealth is really that intersection between medicine and technology. And so we wanted to make sure that we got both sides of that connection involved in that part of the study. So as a result, we ended up with about 6 key findings in our story. The full report is available at our website, www.connectednation.org. But in brief, what we found was that obviously access to and use of home broadband service is an issue both for providers as well as for households. If people are not able to connect to broadband, they're not going to be able to use these services. And as well as for healthcare providers, they could and they have committed millions of dollars to getting their internet system set up within their networks. But if the connection between networks has issues, then that can cause problems and make it harder to use those applications. So we also found out that a lot of households had concerns about the safety of their online information, as far as their privacy and the risk that some of that information may get shared to or shared with parties they wouldn't want it to. And reimbursement, making sure that or making sure that any telehealth service that they receive will be covered by Medicaid, Medicare, their insurance. A lot of times that kind of varies from network to network, and so that's something that is being addressed nationally and at the state level right now. Amongst the healthcare providers with whom we spoke, we saw that in addition to the reimbursement issues, just the ability to find the funding sources that could help them expand their services, as well as the ability to integrate different tools with each other and get those different devices to communicate are big issues, some of which can be addressed by more centralized information sources or databases. And so that was something that we saw that whereas in some states where they have the more centralized information sources, that has really helped providers. And in states that didn't have that, the providers were at a bit of a disadvantage. So, as I said, this has just been a very high-level overview of our full report. Please check it out. Once again, it's www.connectednation.org. But it's really opened a lot of eyes, and the people with whom we've shared this have really gotten a lot of information out of it, I think. So it's really been an honor to work with a lot of really fine people on this project. And speaking of fine people, I will then hand it back off to Tom Stevenson. Thank you.
Thank you, Chris. And it's my pleasure now to introduce our two feature speakers today. Mandy Reed is the Director of Operations for Virtual Health at Spectrum Healthcare. Spectrum Healthcare is a 14 health system based in Western Michigan. Mandy leads primary care and ambulatory efforts focused on the integration of digital and virtual solutions in care delivery. Through the integration of technology and change management, virtual health is able to offer patients enhanced access to lower costs, more convenience at the most robust healthcare program in the state of Michigan. Mandy's career experience is in business development, physical relations, and operations, which has been beneficial in the transformation of healthcare delivery at Spectrum Health. And also, Mandy is also a Michigander. She received her degree at Health Administration at Grand State University, where she also serves as a professor within the School of Public and Nonprofit Health Administration. Our second feature speaker is Rima Shah, who is the Vice President, Department Chief and Primary Care at Spectrum Healthcare. She is a board-certified intern medicine physician. Dr. Shah earned her medical degree in Khyber Medical College in Pakistan. She completed her internal medicine residency at Resurrection Lakeside Hospital in Melrose Park, Illinois. Dr. Shah's clinical interests include preventive medicine, chronic disease management, and training medical students and residents. Mandy, Dr. Shah, that's all yours.
Thank you so much for the introductions, Tom. If you could advance our slides, that would be wonderful. Do we have you guys there still?
Yes, we do.
Okay.
I think, Ryan, you're transitioning to the Spectrum slides.
All right, wonderful. Well, thank you so much for the introduction. I just wanted to quickly talk through the agenda that we will be discussing. Wanted to give you a little bit of an overview of the virtual program within Spectrum Health, and also to discuss a little bit about our COVID response as far as the telemedicine and virtual implementation, and also talk about the virtual landscape, and then touch on patient experience, technology and connectivity challenges, and what does the future really look like when we talk about telemedicine. So as mentioned earlier, Spectrum Health is an integrated healthcare system, has a medical center, multiple regional community hospitals, as well as a dedicated children's hospital, also has multi-specialty medical group, and also has its own priority health as its health plan. This slide is from 2019, so it shows 40,000 telehealth visits, but it's actually just Spectrum Health Now virtual visits that we offer. And most recently, we have had about 260,000 telehealth visits.
So just to give you some background, we wanted to include this information in this presentation because it gives some more visibility into the maturity of the program. So virtual is new to a lot of the world right now, but It's not new to us at Spectrum Health. We have a very robust program that offers a lot of variety, from low acuity with patients in their home, including primary care and specialty care, all the way from remote monitoring, device integration, all the way into inpatient and more continuous monitoring stages. So we'll talk a little bit more about the lower risk, but a lot of what we're focused on here today is talking about the virtual in-home services that have expanded, and how we have expanded to now offering primary care for new and established patients, for consults, for follow-up, all virtual, on demand, so in real time, and then also specialty care for new and established, and other services such as asynchronous, similar to what Melissa was mentioning before. So just a quick visual to show you the depth and breadth of the program at Spectrum. And per Rima's comment, the virtual program, I mean, we really set out with the intent many years ago, a little over 5 years ago actually, to bring more access to consumers and patients. So the intent was to give more access options, but also decrease the amount of wait time to actually be able to see a provider by opening up the ability to see more providers virtually, regardless of where you are in the state. So to program to date, through COVID, we have seen about 262,000 virtual encounters, avoided over 400 inpatient transfers, and also avoided close to 35,000 ED and urgent care visits for patients, and enabled them to save over 2 million miles throughout the state of Michigan. So I point out these numbers because it's really important to show the experience of our providers and the health system in performing and conducting video visits, not only from a clinical quality perspective, but also from a technology enhancement perspective. And so for patients, really, our focus is to be accessible, reduce costs, and allow greater access to care.
So I just wanted to quickly just stress how the COVID response really escalated our efforts in virtual implementation. We always had virtual platform available to mostly our primary care physicians in the ambulatory spaces. And we had a plan to implement and really teach and give those tools for all of our providers within primary care so that they could provide that virtual visits to our patients. However, when COVID hit, it was a 3-year plan prior to COVID. When COVID came, in this pandemic, it was soon realized that we need to keep our patients safe as well as our staff and providers, and also wanted to make sure that we had some connectivity with our patients so that we are not delaying their care and we are not putting their care on hold. So this urgency was realized by the system, by the providers, by all the leaders, and we're able to implement a 3-year strategy within 2 weeks and equipped our providers with these virtual platforms so that they are able to continue to see their patients. And what we saw was in 98 visits per day to almost 2,000 virtual visits per day when we were taking care of patients during COVID. We were able to train about 1,600 providers in 2 to 3 weeks of time. We also realized that not only physicians and providers that are taking care of patients, but also there are so many other important members of our team, like 13 pharmacists, 40 behavioral health providers, 50 care managers were also trained and provided with this platform so that they can see their patients through virtual video visits. And medical assistants are an important part of the care team. They were also trained and given those tools to be able to help and see patients virtually. And we still about 3,000 unique providers and staff members using the virtual platform per month, which is pretty significant.
So I'm going to run through these because I want to get to the meat of our conversation towards the end of this presentation, but I really wanted to highlight the patient experience because we focus a significant amount of resources and time on making sure that we are creating a good patient experience and continuing to enhance that. So instead of just creating tools for patients to use, we want to make sure it works well and is continuing to meet the needs. So again, with the intent to open up access, keep care local, and offer more convenient options at a reduced cost. Those are our overall goals here from a virtual perspective. And then I'll walk through on the next slides here just real briefly the areas of focus for us. So appointment time selection has always been really important for us because we want convenient options, and convenient options aren't there unless we give patients and consumers the ability to choose what works for them. So having full visibility and transparency to schedules is key in creating an ideal patient experience for us based on feedback from our patients. Being part of an integrated health system is critical, and I think for a lot of reasons really sets the services apart from many others and is becoming more standard across the nation and across the industry as we talk about the benefits of it. So having the ability to be part of an integrated health system means that as a patient who our providers are, the quality associated to it, and there's an ability to have a continuity of care between your payer, your health system, your offices, and your entire digital experience. Rima, I'm going to pass this one over to you.
Yeah, I think one of the things that I really wanted to stress that virtual video visits are really a complement to an in-person and really not a replacement for an in-person visit when a patient sees their provider. But it is seen as an enhancement, as a complementary additional access that we can provide for our patients. There are many services that we provide for our patients and ask them to come to the office, really not very patient-centric approach. We really need to think about how can we keep the patient in the center and look for their convenience. Sometimes patients are asked to come into the offices unnecessarily when this can be done in a different way at the convenience of the patient. How can we connect with the patients virtually and get that information that is required? May not really require an in-person, but a virtual video visit would be much better than a telephone encounter. Also, there are newer technology available. We just have a contract with TytoCare, which are devices that patients can have at home and has a stethoscope attached to it. It has a, you can see inside the ear, inside the throat, listen to the lungs and heart, and that is attached directly to the video platform. So a provider at the other end can actually hear heart sounds, lungs, do a good physical exam with those tools that are available. And so safety and the quality of care is also up there and much better than a telephone encounter that you could just call the patient and get that information. Now you can actually examine them through a virtual video visit. In addition, there are areas, especially in rural areas, where there may not be specialty care and patients have to drive all the way to areas like Grand Rapids because the specialists their offices are there. So having this virtual video visits, a specialist can actually connect with patients in providers or primary care offices within rural areas where a specialist may be in Grand Rapids but can actually do a consultation, provide those services that are not available. Convenience is a big thing. Elderly patients, transportation may be an issue, or weather, winter time when the roads are bad. I think that all of that is really helpful in providing that care that is more patient-centric and more of an addition to the inpatient, face-to-face visit rather than a replacement for it.
Perfect, thank you. So medical assistant support. This is a huge differentiator for a patient experience from our perspective. Being able to have a high-tech environment, but understanding that not everybody is high-tech, being able to have virtual experts available quickly to help support any needs, but also to walk you through the experience in a very similar way to how you would in person has really been more has become more of a best practice in being able to provide an additional level of support to patients as they're connecting to virtual visits. EMR integration. So with an app, I'm going to talk about a little bit more in a second here. It's really critical as we talk about continuity of care, best level of care and practice, and very clear expectations with providers and between patients to have everything, all medical information entered into Epic and our EMR in a way that would allow for an enhanced digital experience. So as we talk a little bit more about the app, we talk about this central access point and central place to communicate, to have visits, and really be able to manage healthcare holistically from a patient's perspective. So being able to have multiple capabilities and functionality from a single app. For example, messaging providers, viewing your results, scheduling appointments, having your video visits, also accessing links and sharing medical records with your provider or even outside organizations is a critical part of how we're enhancing the experience. And many health systems and vendors such as Epic are working together to help the experience overall. And then 24/7, 365, we talk a lot about having full transparency to schedules and availability, but we also want there to be on-demand services. So being available 24/7, 365, we want to remain consistent in being able to be available when patients need us and from the comfort of wherever they are, whether it's at work or in their home. It's been a critical, waivers introducing, removing restrictions on originating site have been an incredible step forward for the industry as a whole. And it really allowed us to continue that model across all ambulatory services with primary care and specialty. But specifically on demand has been one that we keep at the forefront as well, because we have a commitment to being available to patients when they need us. So I threw these slides in here actually because it's fun to reminisce a little bit on history, because we used to share this slide a lot several years ago when trying to convince stakeholders that there was value in telehealth. So I wanted to include it in here just for some historical reference, but also as a comparison to see where we are today. So right here, and Ryan, if you don't mind, you can click one more time here. But this cycle here shows really what a patient living out of Marquette, Michigan would experience from an out-of-pocket cost to visit a specialist in Grand Rapids. So this is out-of-pocket costs that excludes medical expenses. With a patient living in Marquette, Michigan, on an average household income of about $37,000. Also, we're making some assumptions here that many of our rural areas are very similar to this experience here. So the evolution of scheduling an appointment, being able to take time off of work to travel to Grand Rapids, the actual travel time with someone that is most likely accompanying them to the visit, navigating our parking ramps and downtown more specifically, and then parking, finding elevators, navigating through our hospitals, waiting in the specialist office, waiting in the waiting room, waiting in the exam room. There's a lot of wait time. It's a trend we're all aware of. And then even meeting with the specialist for about 15 minutes. So, and then leaving and navigating and traveling home. So just a life cycle of a historic specialty appointment is about 14.5 hours and a lot of expense. So it's about $600 out-of-pocket patient cost. And then we proceed to what we talked about in the next slide as being an improved state, which was even relevant as of last year. So as of last year, we improved this by bringing virtual services to a patient's community. So having them go to their local hospital to be able to have that appointment virtually rather than driving all the way to Grand Rapids. You can see the reduction in the steps and the confusion, and we reduce a lot of that out-of-pocket cost. So dramatic decrease in patient out-of-pocket costs from that $600 approximately to $14. And we reduced the amount of time from about 14.5 hours to 40 minutes. So already significant here, but what I am even more excited about is the next slide that really shows our current state with COVID response and a true focus on virtual expansion and adoption from a patient and provider perspective. So current state, that same patient, that same visit, what we're looking at from a total out-of-pocket cost is $0 in about 20 minutes. And that 20 minutes is almost exclusively with the provider. So when we think about the difference that additional $600 could make to a patient and their family whose annual household income is about $37,000, that makes a significant difference, not only from a healthcare management perspective, but also from a financial perspective and how that patient has the ability to make other decisions in regards to their healthcare that can aid it more and how they can financially respond to that. So technology and connectivity, I mentioned this a little bit before, but we have previously over the last 5 years focused a lot of efforts and resources on enhancing the patient experience and creating a strong digital presence. However, through COVID, we've noticed even more of an accelerated way that we can do that. So a lot of the engagement and adoption we've experienced has allowed us to continue enhancing that, which means that we are even up to next month actually introducing new technology and ways to adopt. And by introducing single app experiences and more convenient and user-friendly ways to interact with the health system digitally, we do also understand that from an internal perspective, from a hospital side, that what we do know now more than ever is that we're going to need to continue that. We aren't building something to just be used. We're going to be continuing to evolve this on a monthly basis to continue meeting the demands of patients and being able to support them.
So just wanted to quickly stress on the fact that, most of Americans, majority, about 96% own a cell phone. And about 3/4 of Americans now own a computer. The biggest challenge, as it was mentioned also in the one of the key findings from the telehealth study in Michigan, is broadband and connectivity. So some of the efforts that we are undertaking is to expand our office broadband with even sharing with public Wi-Fi hotspots. We've also done some pilots as to provide devices for our patients so that when it's time for their virtual video visits, how can we bring those devices to the patient to have those virtual video visits. Also working with some federal agencies to expand broadband so as to help in curbing health disparities, and applying for grants and funding to expand the connectivity and help with devices for those patients who really do not have the appropriate devices to have these virtual video visits. And we really think that virtual telemedicine is here to stay. As mentioned earlier, one of the biggest things is that we have to provide care that is more patient-centric. Not what is convenient for us, but what is convenient for our patients, and provides safe and quality care. It really brings convenience. It opens up access. It also takes care to areas where there may not be specialty that is available. Good examples are behavioral health, access to social work, to behavioral health services is important, and we can take that care through virtual visits to patients. On-demand care, so you don't have to wait 3 months to be able to get in for a rash or some acute visit that you need to have cared right away. So this really opens up a lot of access. Patients can go online and get this care that they need right then and there. Also taking in education and healthcare goes hand in hand, and taking in all this virtual platform into schools to provide behavioral health care to students in schools as well. So I think this is going to expand further. Telehealth will open up so many different ways of providing care and good quality care. So thank you very much. We'll open it up for questions.
Yes, this is Tom Stevenson again, your moderator. We do have a couple questions here. Number one is this: is the Spectrum Healthcare virtual health, is it available in the entire state? Say, for example, in Southwest Michigan.
Yes, it is.
Okay. And also we have another question here. So if a person gets an online is consulted online, requires a in-person consultation, must the patient travel to a Spectrum Health location, or is it possible for a local doctor to host a telehealth visit with the patient in their office and a Spectrum Health provider virtually?
It's both. They can, patients can have a appointment virtually with a specialist through a primary care provider, and they can also do it from home. If there is a referral placed to a specialist from a primary care physician, they can actually schedule that appointment as a virtual video visit from home.
And we have another one here. Talking about broadband and the broadband speeds, and I've talked to Mandy about this several times in the past, the availability. What role do you think the speed and latency begin to serve limiting factors to where telehealth services go in the future? I think we're talking about, in some cases, satellite internet service, which just has a higher latency rate than typical fixed line broadband.
That's a great. Yeah, I'll try to answer that. I think, so we know that, even for those patients who we do have a virtual appointment scheduled with and do have the devices and the ability to connect, there is still, the barrier of that connectivity not being strong enough. So when it is not strong enough, currently we're able to, refer to a phone call to kind of wrap up the visit and or escalate them to come in if they weren't able to complete a visit that way. But the reason I say that is because the level of connection is still, we don't highlight that enough. We focused a lot on not having any connectivity, but having increased the ability to have a greater connection is definitely of need for us. And I don't know if that's way off from what the question was, or if that helps at all.
No, that helps a lot. In today's definition of broadband, is 25 megabits down and 3 megabits upload speeds. Is that sufficient for the majority of the telemedicine services already now for a person at home?
Yeah, I will say yes. We've tested that against the app performance. So I would say yes, and but I know that there's other variables to working, and depending, there's a lot of questions right now, with students and kids home. The amount that's being used at one time is often in question, and there's a lot of guidance and support we provide to be able to help patients know that beforehand, maybe just pause or turn off that Wi-Fi and other devices to help support a better connection with the clinical visit. So I guess in general, I would say yes, but I'm just a little bit hesitant when it comes to other in-home use right now. That's more of a factor with kids and education being at home as well.
Yes, very good. Yes. One of the other questions that, of course, I think Tom Free talked about it earlier. We're this study is more or less on adoption and use. So, with your patients, do you think there should be a higher level of education? Is there a gap there that should be addressed?
So I think Mandy, I can take that, and then I'll love you to comment as well. I absolutely, I think there is some technology, learning of that, some understanding of how to download the app. And we have developed, some workflows to help patients. So if they are scheduled for an appointment, our staff calls them a day or two before to see if they can help walk them through some of those downloads, how to connect, and also develop some workflows where when they come in to see the physicians in person in the offices, we are encouraging them to bring their devices to see how we can help or give them a little tutorial and help them walk through those.
Okay, very good. Talking about the app, I've got one question here. Did seniors participate in the development and testing of this app, or was it just young developers that put this together?
That's a great question. We have several members of our PFAC, so our Patient Family Advisory Council, who are participating in using it and giving feedback to us directly in what could be improved and where their most troublesome spots are. We didn't have a lot of that pre-COVID, but continue to monitor it. And I love that question too, because we have to spend a lot of our time we have patient surveys that we do review regularly to see where those pain points are and make sure that we have it on our list of items to address and enhance, because we know that the app experience needs to be not clunky and as few steps as possible and easy to access, especially for those seniors who may not even right now have support at home to help them walk through setting it up. So we have a lot more to continue doing to focus on that with our patient advisory councils. And that's our goal moving forward as well as we continue to enhance the app experience.
So I'm going to try to do, we're going to have one more question here. Will the Spectrum Health virtual program cooperate with other healthcare systems such as Mid-Michigan Healthcare, doctor-to-doctor visits, virtual consultation needed as a patient, as an advanced patient?
That is an awesome question, and we have been talking about how we can do that as a physician-to-physician virtual consultations, or from one system to another. So there are a lot of ideas and thoughts, but nothing that we're doing currently. As mentioned earlier, we had what we are doing right now was a 3-year plan, but because of COVID, as any other healthcare organization, their virtual telehealth strategy has been catapulted, and now we've done it in 3 weeks. So there's a lot of things that we have to do to expand and make it better, and different ideas. And this is one of the things that we have discussed, and has a lot of, I think it's a great idea, and maybe it will come to fruition.
Very good, very good. Well, I really appreciate Mandy and Dr. Shah. Appreciate you being here and participating in this, and I commend you on launching a 3-year program in 3 weeks. So I really appreciate you taking the time with us today, and I thoroughly hope that everybody enjoyed this webinar. And I just want to remind everybody, remind them that we'll be having a second webinar scheduled on July 21st at 1 p.m. So if you have any questions, please contact information here is info@connectednation.org, or follow us on Twitter, Facebook, or website. And Ryan, I'll turn it back to you. Thank you.
All right, that concludes our webinar. Thank you for everyone joining today, and we'll be following up with information as far as the presentation, recording, and slides after this webinar.